everybody, welcome to the New Teeth Now webinar. Dr. Richards and I are 6 feet apart, so we are removing our masks so that you can hear us better for clarity during the webinar. But we are, of course, following all protocols in our facility of keeping things as safe and sterile and clean as possible for you, our patients. So welcome to the New Teeth Now webinar. Tonight we're going to be talking all about dental implants and all that New Teeth Now has to offer. And thank you for joining us. We're very happy to have you with us. So we'll go ahead and get started. How are you doing, Dr. Richards?
Doing well, thanks.
Very good.
Thank you.
We might as well jump right into things.
Go ahead.
And get to know you a little bit. So, Dr. Richards is a board-certified oral and maxillofacial surgeon since 1982. So you have over 40 years of dental implant experience, and you are the innovator of New Teeth Now.
I think that's right.
I'm glad you confirmed. So, as being here since the beginning of this innovation,
Right.
Why do you feel it is important to provide this service for patients?
Well, primarily got into doing this because of functional impairment. That basically people are cripples, dental cripples. People would find themselves in dentures. Dentures are very crude, been around for probably more than 100 years. I think George Washington had wooden dentures, so the story goes. But in any event, people who find themselves in artificial teeth, some adapt well, others don't adapt well. And so what we're able to do is provide some return of normal function and quality of life. And I think that's probably the most professionally satisfying thing that I can do for people, give them their life back.
Yes,
Yeah.
definitely. And going into kind of the anatomy of what a hybrid looks like, we'll go ahead and take a look at that now. So this is a fixed upper hybrid, and can you tell us a little bit about what we're looking at?
Well, basically it's a bridge. A bridge, connects things. You can have a bridge over a river, it connects one side to the other. You can have a bridge of teeth. You could have a 3-tooth bridge, Bianca. You could have a 4-tooth bridge. What we're talking about here is a 12-tooth bridge. It replaces a complete jaw of teeth. It's fixed, means it does not come in and out. It's upper, that's obvious. And a hybrid, the hybrid part means that the position of the teeth and the position of the implants does not necessarily have to coincide. So many people we see have deficient bone, and there's not enough bone to put implants where the teeth need to be. So the implants go where the bone is, and the teeth go where the teeth need to be, and there's not a direct relationship. Whereas with a conventional fixed bridge, the implants would be placed directly into the position of teeth, and then when the bridge is fabricated, it would look tooth-like, more like individual teeth, or they could be individual teeth. Whereas even though the hybrid looks like individual teeth, it's not really. It's a solid prosthetic device that bridges around typically somewhere between 4 to 6 or 8 implants. So the hybrid concept is very popular these days.
And for functionality, what's the difference between the hybrid and like a denture per se?
Well, there's no comparison to the functionality between a fixed bridge and a denture. The denture is going to be loose. It sits on the mouth tissue, the mucosa. It may slide around and present ulcers on the tissue. There's not near the chewing efficiency with a denture. So the fixed upper hybrid is going to take a person who has no natural teeth and put them back into a situation where they are as close to having natural teeth as possible.
That's ideal. And then here's what the lowers look like.
And the lower is very similar. The difference between the upper and the lower really is more in the anatomy of the jawbone The upper jawbone has different structures, sinuses, the opening of the nose, whereas the lower jawbone has the nerve that runs through the jaw. So the primary difference is the bony structure, not the fixed lower hybrid. It's still fixed, it's a lower this time, it's still a hybrid. So the prosthetic device, the teeth are the same. It's where the implants are going to go. The jaw is different.
Okay, right. And so this is an overview of the New Teeth Now procedure. So on the day of surgery, the patient will be put in a deep sleep under general anesthesia for their pain-free procedure. And then if they have teeth, they're extracted. And then you'll place implants, about 6 or so on the upper and 4 on the lower. And while the patient is still asleep, you're going to take impressions for the lab to customize those teeth. And then the patient will wake up in a private recovery room and rest there while our in-house lab is creating those teeth. And those teeth will be placed in the mouth and adjusted before the patient goes home that day.
Right, that's right.
So it's a very streamlined procedure.
Right. Yeah, this slide is the one that I like. You know, we recognized about 15 years ago that to do these complicated procedures, you needed to have all the players in one spot. And the players are the surgeon, the restorative dentist, and the commercial dental laboratory. And so we began working to that end, and it took us till about 2013 to fully get to that point. And in 2013 we opened our own in-house lab to support the procedures that we do. Early on we brought into our practice our own restorative dentist who does nothing but make implant supported teeth. And so with the addition of the lab in 2013, it sort of closed the circle. And so our business operates in that dark area that says New Teeth Now, where you have the intersection of the surgeon, the lab, and the restorative dentist. So all in one day, all in one office. Our patients come here. Everything is done here. We don't outsource anything. They don't have to drive down the street. They don't have to go anywhere because everything's done right here.
Right.
I would say the only thing that's not in that is that we have something that probably no one else has, and that is we have an anesthesia department.
Right.
And so we do most all of these procedures under general anesthesia with a separate anesthetist administering the general anesthesia. So our patients are fully asleep. I mean, there's a breathing tube down. They are totally asleep. We can work. We don't have to worry about gagging and coughing and dropping something down the airway, gag reflex. I mean, all of these things are a non-issue because we do these procedures under general anesthesia.
Yeah, so that's very important when you're looking for a facility to have that and have a member dedicated to that. And if we want to look really quick at our actual facility, just so you all can see where we are and the size of our facility, everything is right here. And
the building in the forefront there is the original building, which had one operating room, which we are actually broadcasting from that room right now. And the building in the background to the viewer's left, the two-story building, is the laboratory upstairs along with the restorative dentist. So our restorative dentist has his own lab right there at his disposal, and you know, you may hear Dr. Dibbs in a little while. I don't know if we're going to do that today, but he can give his little spiel about how important that is in the relationship of the dentist to the lab and to the patient and getting a better result.
Yes.
I mean, it's what it's all about, getting the absolute best result by bringing everything under one roof.
Exactly.
Downstairs are 2 operating rooms, and they're mirror images. They're operating rooms that would be exactly like what you'd see in a hospital. And all the life support safety equipment. We have a generator that runs the entire office should a car take out a power line out on Hardin Boulevard or a thunderstorm.
Mm-hmm.
It's almost seamless that the generator comes on to restore the power to the building. So
That's very important.
yeah, we had a lot of thought and a big investment in the facility to make it as safe as possible.
Yes. And so you've heard a little bit about the procedure, and now we're gonna see and hear from some of our patients. So this is Shirley. She's from the UK and had years of pain, dental pain. She couldn't eat certain foods that she loved, and she was just extremely self-conscious. So we're gonna learn a little bit about her story and how she's doing now.
You can't eat apples, you can't eat steak, there's all sorts of things you can't eat. I also couldn't eat sweet things. I was always at the dentist having something put back, or I was just in severe pain. I saw an out. Here was something that I could do, which was going to take away all the years of hurt, pain, and people looking at you like you don't take care of yourself, maybe. I know that's in your mind, but it's a big part of how you feel when your teeth don't look good. For New Teeth now to give me a solution, it's just been life-changing. I didn't want anyone else to do the procedure but Dr. Richards, because I really, really trusted him.
So we put her to sleep, removed all of her teeth, trimmed up the bone and infected tissue, installed 6 implants in the upper jaw, 6 implants in the lower jaw, and that afternoon we put the teeth in, and she and her husband went home.
I really liked how Dr. Richards spoke. I liked how he behaved with people. My husband and myself got on with him really well straight away. It was the connection I needed. I needed to have spoken to somebody one-to-one personally. Dr. Richards solved the problem. I wish I'd known about New Teeth now several years prior. The fact that you can go there and come away with teeth in one day, to me, is just mind-blowing. Now I can just eat what I like. You know that really hard toffee that you can get with the chocolate on it? I just love that. And so many people compliment me and say how beautiful my teeth are, that it just made a huge difference to my life. I think I'll be a lot more confident again.
So as you can see, Shirley is doing wonderful with her new teeth. She can eat, her chocolate toffee again and all the foods that she was missing out on. And for anyone who's just joined the webinar, we are still social distancing, even though we don't have our masks on, and that's just for clarity so you guys can understand us. But yeah, so for Shirley, she really she loves her new lifestyle and what she can do.
Yeah. And from my perspective, it never ceases to amaze me how something, and I think I say this pretty much every webinar, how something that literally we do on a day-to-day basis, that's routine, that we don't even really think that much about, can have such a profound impact on someone's life.
Yes.
It's very humbling, really.
Yeah, it's really incredible. So these are what traditional implants
Right.
look like.
Yeah, that would be a typical, customary procedure that would take probably 3.5 hours and just kind of routine under general anesthesia, where you can kind of move on through the procedure, and then the person would get their teeth at the end of the day. But these are all just traditional implants placed to avoid the sinus by tilting in front of the sinus and avoid the nerve as well, and just what we do every day.
And some people may look at this and think that it looks painful, but what's the pain level?
Well, the pain level is typically over-the-counter medication. I talk to everyone at the consult, and I tell them that. And I tell them that when you come back for your first post-operative visit, and I'm going to ask you, how many prescription pain pills did you take? And I'm going to tell you that it's probably going to be 2 or 3. And almost to the T, most people get by on over-the-counter large doses of Tylenol and ibuprofen and take very little prescription codeine. So, you know, I think it is a testament to how much of this that we do and how we handle the tissue, both soft tissue as well as the hard tissue, and how meticulous we are at what we do. And I think that contributes to the lack of post-operative complications.
Definitely. And the fact that you're doing it almost every single day,
Right.
it's just, it becomes just the experience is incredible. And so we'll talk a little bit about zygomatic implants, which are a little bit different from traditional implants.
Right, a lot different than traditional implants.
Yes.
Right. So zygomatic implants have been around for a while. We have placed zygomatic implants in our practice since around 2006. Sort of migrated towards zygomatic implants because of failed sinus bone grafts and other technical issues that are beyond the scope of this webinar. But traditional sinus bone grafting provides bone in the rear part of your upper jaw, but not in the front. So, you know, you cannot have all the implants in the front. You cannot have all the implants in the back. They need to be spread around. And so in your little bag of tricks, you need to have the tools that enable you to place the implants around the arch, evenly spaced, and zygomatic implants are the tool to do that. Zygomatic implants do not require bone grafting. Zygomatic implants require a steep learning curve. And both Dr. Kirkpatrick and I have been doing zygomatic implants since around '07, and we do zygomatic implants with our eyes closed. Now, actually tomorrow you and I'll be doing a procedure that will be similar to actually this, a quad zygomatic implant, where the person has no bone in the front, no bone in the back, doesn't want to undergo bone grafting, found her way here by hook or crook. I don't know how they find their way here, but a lot of people do that have no bone because they go around and everybody looks at them and says, you don't have any bone.
Yep. And
so they see a website or something, they come here and we do zygomatic implants. Now, that word, that funny word, zygoma, the zygoma bone is this bone right here. It forms the lateral inferior of the eye socket, and it is the prominence of your cheekbone. So these implants anchor at the jawbone and the cheekbone. And it's a very technique sensitive procedure, but once you get it down, it is extremely predictable and trouble-free. Zygomatic implants cause no more problems than traditional implants if
Right.
done
properly
by an experienced person. So quad zygomatic techniques are a little less common than, there may be another slide that shows a more typical zygoma technique.
Yeah, we'll look at this.
Where
Well,
there are traditional implants in the front of the jaw where there's bone, and zygomatic implants in the posterior or the rear part of the upper jaw where there is no bone. So sometimes we do unilateral zygomatic implants where there's bone on one side that's favorable and not on the other. So, you know, everybody's different.
Right.
We can mix and match different techniques to suit the anatomy of the individual person.
Yes, definitely. And we are one of the few facilities in the country, if not the world, that routinely place zygomatic implants. So if you are here with bone loss, you're in the right spot, definitely.
Yeah. The people who sell them tell us that we do more than anybody in the country.
There you
And
go.
we do a bushel basket full, I can tell you. There's a lot of cripples, a lot of dental cripples who have no upper jawbone, who cannot wear a denture adequately to function. And not only function to chew, but function in society. I mean, you know, they got a big old chunk of plastic in their mouth that's flopping around. And, you know, trying to deal with polygrip and glue and stuff like that, it's very awkward socially in addition to functionally.
Right. And we'll take a look at your team. So this is Dr. Richards' team who assists him in surgery and with post-ops and basically everything. And how many assistants, so I guess tell a little bit about how they help you out during surgery and in the day-to-day.
Well, I couldn't do it without them, so that probably, you know, says it best. They're highly trained. They are able to remove teeth, clean them, put them back in, check screws. You know, they help me so much, it's very difficult to, you know, with words to, you know, tell you how much they help me. But I couldn't do it without them. They're a bunch of good gals, and they're all very smart and capable. So
Yes.
I can't say enough good about these gals.
And then this is the anesthesia team, which you
Right.
mentioned earlier. So we have Jack and Kim, who have, you know, over 25 and 30 years each of experience.
Right.
So
So these are the two main anesthetists, and they're both CRNAs. So what they are, they're advanced. They are ARNPs. They're advanced nurse practitioners, and they're also CRNAs, certified registered nurse anesthetists. So they administer general anesthesia for us because our facility and Dr. Kirkpatrick and I are also licensed to do general anesthesia, so we're able to have anesthetists do general anesthesia in our office. Other dentists who have IV sedation permits cannot bring a CRNA into their office and administer general anesthesia. So there are other CRNAs that we have if Kim or Jack are on vacation, and we have one anesthesiologist. So we have really about 5 that kind of rotate around, and they're all really good, capable, quality individuals, and we run our anesthesia department exactly like they do at Lakeland Regional Medical Center. Not everybody, people who require it get a medical clearance from their physician. They may need a medical clearance from their primary care doctor, from their pulmonary doctor, from their cardiologist, from their endocrinologist. We see a variety of medical problems: heart, lung, diabetes, all sorts of things. So we're continuously receiving, reports and cardiograms, and these people are reviewing all of that and clearing, our patients to make sure that they have a safe anesthesia experience.
And you had mentioned a little bit about IV sedation. So
Yeah.
why don't we do IV sedation? Because a lot of places do.
We do general anesthesia for the reasons that I mentioned earlier. I mean, the airway is totally protected. There's a breathing tube that goes through the nose down the breathing passageway, the trachea. And on the end of that little tube is a cuff, and it's inflated, and it totally seals off the airway. So when I am drilling on the bone, that if you have used a little drill at home, if you drill into a piece of wood, it gets hot. Well, if you drill into the bone, it gets hot. And bone is living tissue, and so we don't want the bone to get hot, because if the bone gets too hot, the bone cells will be killed, and you won't heal well. So we can use a lot of sterile saline irrigation while we're drilling, and the person, because they're under general anesthesia, will not gag or choke or have to rest, or you don't have to worry about dropping anything down their throat. Everything's all sealed off. And we can just move ahead without, breaks, and do these procedures in a reasonable period of time, 3.5, 4 hours.
Mm-hmm.
And the person, most of you out there watching the webinar are old enough to where you've had, something, or a colonoscopy or something, and you know that when you go out, it's like the light goes out, and then all of a sudden, click, you're back.
All done.
It's 3.5, 4 hours later, you're all done, you're happy.
Yep.
So general anesthesia works very well in that regard, and allows us to do really a lot better job.
Yeah. And this is Dr. Dibbs, who we also talked about before.
Mm-hmm.
He's our full-time restorative doctor, and we're going to hear a little bit about him and his relationship with the lab. So we'll go ahead and watch that video.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
And so you got to see a bit about what the lab does and how crucial and amazing that it is that we are able to work with them on such a close basis for the patient. And so here is our in-house dental lab team, our master artisans, and they work every day making teeth.
Yeah. And I think Dibbs pretty much sums it up, you know, with the lab and all of the benefits of having your own lab right at your disposal.
Yes.
Because you stay within the ring, you stay within the common area of the rings. You're not going outside. And you're keeping the quality control in-house.
Exactly.
And I just can't, I think Dibbs stressed that enough, you know.
Mm-hmm.
I mean, he does a good job talking about that.
Definitely. And I always love this picture just because it shows, so the set of teeth on the bottom, those are acrylic teeth that have been used for 5 years, and on the top is a set of zirconia teeth that have also been used for 5 years. So you see here the automatic difference in the quality of zirconia teeth, which is what we place for our final teeth. They haven't yellowed or broken down, they don't absorb stains. And so do you want to go over a bit about, more about those differences?
Well, I think you pretty much summed it up there. I mean, the acrylic absorbs stains and odors. It's difficult to clean. It has porosity. Whereas the glazed finish on the porcelain stain over the zirconia is impervious to stains. And now, if somebody's heavily into coffee or iced tea, it may stain, but it'll come off pretty easy.
Yeah.
So, but for durability and the ability to chew, the zirconia is milled out of one piece. So it's one structure, whereas the acrylic has individual denture teeth, like a denture, has individual denture teeth that are set into denture acrylic. So basically the acrylic one is made out of denture material, but it has the hookups to the implants. It's still a bridge, it's still fixed, it's still a hybrid.
Mm-hmm.
It's just the material that it is made of is not as strong and durable. And so I think a lot of dental offices that dabble in this business still provide their patients acrylic restorations, but our final teeth are all zirconia restorations, and they look better. They look better. They transmit light more like teeth, so they look like teeth. It's really not individual teeth, but they look that way.
They really look very natural.
Yeah.
You would never know.
And so unless somebody has a really high lip line when they smile, you wouldn't even see the artificial gum part here.
No, yeah.
And so this is the state of art anywhere in the world, really, right now, is zirconia.
Definitely.
Yeah.
So that's definitely the material that you want for your final teeth. And so going into a bit about logistics, these are our implant coordinators, Shauna and Debbie. They have been with us for a very long time, and they're the ones that you would meet with when you come in for a consultation, as well as with Dr. Richards. But they'll take you through the process step by step, answer all of your questions, and are basically there every step of the way when you get your when you get your teeth. So you're taken care of. And especially if you're out of state, they also help with that logistics and planning. So overall, very, very helpful and sweet ladies. And here is a photo of the CT scan. It's an open scan, and that's the first, when you come in for the consult, that is the first step, is you're going to have that CT scan taken, and that will be evaluated by Dr. Richards for your bone levels and what's needed. And then you'll finalize the treatment plan at the consultation as well. So definitely a good idea if you're interested to come in for that consultation, so your needs are addressed individually and you can come up with that treatment plan. And as far as learning a bit more about our patients, so this is Bruce. He's from Orlando, and he had a lot of pain and he couldn't eat the foods he loved. So similar to Shirley and a lot of our patients.
Yeah.
And now he can eat anything he wants. And I always love hearing what, the foods people are most excited about eating, like steak, apples. What have you heard that people can't wait to eat?
Yeah, pain and not able to eat are evidently big things that those of us who don't have pain and who are able to eat cannot appreciate those things.
Yeah, we take it for granted, definitely. Yeah. And this is Nathan. So he is a reptile trainer and a wildlife conservationist, and he has his own wildlife refuge where he has alligators and lots of different reptiles. And basically his story is very interesting, and we're going to hear about him in just a minute. But he sustained a facial injury from an alligator accident, which cracked a lot of his teeth, and is the root cause of his constant oral pain that he had, which ended up leading to degrading overall health. So Nathan's story is very interesting, and we're going to take a look.
When people are afraid, they freeze. So when you freeze up, that will get you killed in my industry. I mean, there's definitely a very, very healthy respect. I've been studying, you know, behavior and all that stuff specifically with alligators and crocodiles and what I work with and train for almost 30 years. I'm not fearless, but I don't ever let fear in the room. One of only 2 times that I was bitten by an animal in my entire life. One of them happened to be square in the face. So I was doing gator wrestling shows, feeding demonstrations, all these different things, and I was kind of laying down on a dock similar to this, and I look over my shoulder and there's another alligator that was spooked by the activity and was already in the air. So as I turned to look over my shoulder to hear what the sound was, here I am turning my face right into a jumping alligator's mouth. And it was about 8 feet long and it clamped onto my face. Now you gotta keep in mind, about an 8 to 9 foot alligator is gonna have well over 2,000–3,000 pounds of pressure per square inch in its jaws. So a nice good chomp is gonna do some damage. So it slashed up through the cheek, kind of starting down here by the, almost the gum line really. Back over here, through the cheek, through the nose, broke my nose in a couple places. Tooth pain, especially those exposed nerves. It was like this constant, non-stop, incessant pain, as if somebody had like a small little pen knife and just stuck it in there and would just kind of be twisting it. You know, it started getting to a point to where it was affecting overall health. It wasn't just a, appearance thing and then, being a little self-conscious. I heard the ad come on the radio and I was like, okay, well there's a option for a solution. Plus doing it in one day, I mean, you're not really out for the count for too long, work-wise and everything else. Anytime somebody tells you to count backwards from 10 and the next thing you know, you're waking up all like, what's going on? And something new has happened. It's a little, I guess nervous is probably the right word, but excited at the same time. Drinks on me later.
Okay.
Doing the New Teeth Now experience from when I got to the office at 7:30 in the morning to get prepped for surgery. That was like one of the best days off I've had in a long time. It was such an easy experience and it flowed so well.
Looks pretty good.
Looks like new teeth now.
Congratulations.
Thank you very
Yeah.
much, sir.
Excellent work.
New teeth now.
I married that man.
That's right.
I was excited to see how much energy I would actually have. Like once my body wasn't trying to compensate for, this crazy weird pain thing that was constantly going on. Right away that day, I think when I was coming out of the anesthesia and I was starting to really get my wits about me again, I could almost notice it right away, like, it was like taking a deep breath of fresh air, like, okay. I don't want to say I feel younger, but I feel younger again. It's like the fountain of youth.
So as you can see, it's an incredible story, and his outcome is amazing. Like, he went from all he could think about was his pain in his mouth, and now he has energy, he feels healthier, feels younger, he has his life back. He can focus on, everything else.
Making me
besides
smile just to listen to him.
Yeah.
I mean,
He's a
yeah,
funny guy.
Yeah,
Um,
interesting fella.
Yes. And so this is Crystal. She had painful loose teeth, and she was really tired of covering her mouth. But now, after the procedure, she's laughing, she's smiling, she's talking to new people. It just becomes a whole different lifestyle.
Right. Yeah, that's what I was saying earlier.
Yeah.
She didn't mention anything about eating. She's.
Yeah.
It's all about social interaction.
Right.
And so between those two, eating, functioning, and the social interaction, those are the
Big differences.
Yeah.
Yes. And for another before and after. We love showing our before and afters.
Yeah.
GLADYS, she's from Tampa. She had difficulty chewing, an infection. So another big thing is, cleaning out the infection and having a healthy oral health that affects the rest of your health. It's very important. And so she has a wonderful outcome as well. And we did have one question come in. Will my facial structure be altered at all?
Typically, no. No, we're not going to augment your cheekbones or change the lip support. No. The answer to that question is no. It will not. It will not. A lot of people, depending on what that person's situation is, the teeth and the mouth support the cheeks and the lips.
Mm-hmm.
Once the teeth are gone, those structures sort of collapse. You take an older person with dentures or a younger person with dentures.
Mm-hmm.
You take the dentures out of their mouth and, their
It
lips
sinks
and everything just collapse.
Yeah.
So, but that's just support of the soft tissue inside of the mouth. So, but none of the bony structures will be changed in any way. No.
Okay. If you have been with us for the last hour, you've definitely been listening for a reason, and the New Teeth Now procedure is probably something that you need. You, of course, are in such good hands with Dr. Richards. He can restore your total health and happiness. So I encourage you to give us a call, ask those additional questions, and if you'd like to set up that consultation, we can definitely do that. But we thank you for joining us tonight. Thank you, Dr. Richards, for being here.
Thanks for helping us.
And we hope everyone stays safe and healthy and has a wonderful evening.